prisons are actually very complex environments globally, and this is not specific to Malaysia. These environments are usually highly populated, meaning that it's impossible to have social distancing in a prison, or the facilities are not adapted for that. And it's also very complex to maintain the hygiene standards. That means that in that kind of environment, diseases, communicable diseases, and also viruses can spread very easily. Now, when it comes to Malaysia, we know because the prison department has previously informed that they face an overcrowding. They have already said that more or less 30% of the population is above the maximum capacity. So of course, it's one more cause that make the spread of the virus more easily in the prisons. It's actually more complicated to contain that in the prisons. That's why we think that it's very important to give enough attention to health and hygiene measures and to focus on the quarantine areas, which has been done in most of the prison in Malaysia. The quarantine areas have been put in place, they are settled there, and they tried not to mix the new detainees with the detainees who are already in the blocks. Now we see that it's a good step, but more needs to be done to make sure that the COVID does not spread inside the prison. Well, quarantine areas is only one of the measures, but for sure it's not the only one and it's not sufficient in itself. What is very important is also to ensure that the detainees can have access to healthcare. It's very important to ensure a screening upon arrival and like a very thorough screening to make sure that the detainees don't present any symptom. And then when they request to see a doctor or when they request to see the clinic, it's important to take that kind of request seriously, because otherwise maybe they're already facing like the first symptoms of the disease, and it's when it can be controlled. Now there are also other measures that are very important. So not only the places need to be very ventilated, not only there is the need for healthcare in detention, but hygiene is very important. So the detainees need to have continuous access to soap and other hygiene items. If they
Okay.
don't have sufficient soap, then for sure the hygiene won't be maintained, and it's very prone to spread viruses in such conditions. We can, what we know is that there are clinics and doctors in the prisons in Malaysia. However, globally, everywhere in the world, the prison system tends to be at the bottom of the priorities for allocation of resources. That means that the prison system face lack of resources in terms of staff, in terms of medical equipment, in terms of hygiene items, and other kind of items. So if we want the prison department to be more compliant with the measures to reduce the spread of the virus, it's also important that they receive the resources to be able to comply with that. And that's also where we really recommend to have a good coordination and a good communication between the different state agencies that are involved. So the Ministry of Health, the Ministry of Home Affairs, the prison department, also the immigration department, because some of the detainees after are sent to the immigration detention centers. It's crucial to have a fine coordination to ensure that it can be controlled. Yes. So actually, since the very beginning of the current crisis, ICRC has been recommending to decongest prisons and places of detention, meaning to try to find a way to reduce the population. It can be release on license, it can be alternative to detention, it can be other measures, but at least to try to reduce the overcrowding. For the reasons I have already mentioned regarding social distancing and the difficulty to maintain health and hygiene standards in a populated area. Now, meaning that some detainees would be released, also comes with measures and with a protocol. So if detainees are being released to the community, they have to go through a health screening before being released to the community. It's very important to assess their condition before they return to their families. And once they have returned to the communities, they have to be able to access healthcare services, to have a follow-up and to see what is the situation. So that's a very important measure when it comes to the control of the health risk. Now, when you speak about the other kind of risk, like I think you mentioned security risk, the detainees who are meant to be released are not supposed to be a risk to the society in the sense that it's life sentences only, that it's on license. So there is also some kind of follow-up, and they have already served a part of their sentence. So we are not speaking about release of serious profiles that could come with a risk to the community. It is not what is in question now.